Okay, shall we start?
You ready?
Yep. Okay, good afternoon, ladies and gentlemen, and thank you for coming. Today we will present you presentation prepared by Cornell Humphrey Fellows, and the name of presentation is Gender and Sanitation Issues in Developing Countries. But before I start with the presentation, I would like to inform you and give you some more information and details about Humphrey program and about World Toilet Day. So, first of all, the name Humphrey, Hubert Humphrey Fellowship is named by Hubert Humphrey, who was mayor of Minnesota, who was a senator, and who was a vice president of the United States. Humphrey was a leading liberal voice in the Senate, focusing on issues on social welfare, human rights, and fair employment. He proposed and passed more than 100 bills during his service, and some of them are Food for Peace, Medical Program, Nuclear Test Ban Treaty Program, the National Defense Education Act, the Elementary and Secondary Education Act, and Full Employment Act. That's just the part of the work she managed during his public service. He was promoter of international understanding, peace, and cooperation all around the world. And because of that, President Carter launched Humphrey program in 1978. This program is provided by U.S. State Department for mid-career professionals from developing countries, and they are working in a public sector in their countries. They are hosted by U.S. universities all around America, and the goal of the program is academical and professional improvements of the skills of fellows. So once we finish our program, we can come back to our countries and we can help development of the countries in the area, and with the new skills we gained during this year on Cornell, for example, for us. Up to now, more than 4,600 fellows from all around the world participate in the program, and this year we have 168 fellows from 95 countries, and we are a part of, we are honored to be a part of Humphrey legacy. So on this slide you can see all our names and countries we are coming from, and some of the countries I will list all the countries we are coming from. That's Sudan, Ukraine, Mongolia, India, Pakistan, Papua New Guinea, Montenegro, Ghana, Nepal, Swaziland, and China. So it is 11 countries and 4 continents. Today we realize that it is important to organize and to celebrate together with you World Toilet Day. Probably you are thinking what a lackluster event, but don't think like that, because this is a very huge problem in developing countries, and this is a day when the people from developing sectors, and especially people from water and wastewater sector, has to talk about these issues and has to raise awareness of this huge problem in developing countries. So we decided to break the taboos, as Mr. Ban Ki-moon said, and to talk about toilets here in Cornell. And some people already started to call us toilet people, but yeah, we are not disturbed about that. So let's start with our presentation. You will all agree with me that drought was a huge problem during this summer all around America. In California it was very obvious, but also here in Ithaca. But even if that's true, we had high quality 24 hours clean water during whole days, during whole summer this year. But imagine for the second life of this child. Also, we in developed countries, we are talking about recycling of wastewater and converting wastewater into drinking water. But people in developing countries, they are faced with the basic sanitation issues. And during our presentation, we will be focused just on developing countries and the problems in developing countries. And in according to Maslow's hierarchy of needs, sanitation is a basic physiological need. And we cannot achieve another high-level needs until we don't achieve this first basic needs. So the outline of our presentation today is gender equality and sanitation, basic challenges in developing countries, sustainable development goals, and way forward. So the connection between gender and sanitation is recognized by sustainable development goals, and one of the goal is to achieve access to adequate and equitable sanitation and hygiene for all, paying special attention on women and girls. Now the situation is not like that, and we cannot tell that we have equal access to sanitation facilities because our physiological needs are different, men and women physiological needs. And the figures here just approve the statement I mentioned. So 1 in 3 women risk shame, disease, harassment, and even attack because of a lack of sanitation facilities. And each year, more than 2,000 mothers lose their child because of hygiene issues, diarrhea, for example. Around 500 million women openly defecate. So it is a huge problem, and it is very focused problem on women and girl all around developing countries. If you see this map, we can realize which countries suffer the most from sanitation problems, and we can see that a huge number of population in India, in China, in Indonesia, in Nepal, in Pakistan, they are suffering the most. So these countries are concentrating on mostly in Africa, Asia, Oceania, and South America. And the representative from that countries today, we will talk about their case studies in their own countries. If we make a quick analysis, we will see that more than 2.5 billion people doesn't have proper access to basic sanitation facilities, or their toilets are not connected to sewage system or to septic tanks. Now my colleague and friend, Hubert, will talk to you about basic challenges in developing countries.
Thank you, Maritza. There are a few basic challenges that are faced by the developing countries which are causing the sanitation issues. First of all, we will discuss the norms and beliefs that we have adopted and we are not changing ourselves. There are clear differences of attitude towards the use of sanitation facilities and handling of excreta and their disposal. There are few norms like women are the prisoners of daylight. So if a woman needs to do her daily business, she should wait for the darkness and go for her daily business in the cover of darkness. Some people think that it's a shame or embarrassment to go to toilets, a well-constructed toilet. If they are going and if someone sees them, it is basically a matter of shame or embarrassment. You may be possessed by demons. You will lose your magical powers, and you will your lifespan will be shortened if you are using toilets. Most of the people likes to continue with their ancestral way of using toilets and feel comfortable in open defecation. Excreta must be removed from the home. Otherwise, it will cause a bad smell in the locality or in the home place. Latrines are meant for wealthy persons, and you should not construct a latrine in your house. Otherwise, you will imitate the rich persons. second basic challenges which we are facing is the sickness from dehydration and other diseases caused due to improper sanitation. As it is clear from the this graph, this graph was from the UNDP report, and according to this graph, 82% of 1 billion people are using doing their daily business in open defecation lives in 10 countries. And the highest ratio is in India. 60% of people are like openly defecating. There is a why we are causing this sickness. It is of many reasons, but the most reasons are like women must travel further away to relieve themselves. Due to this, they don't eat food and they don't drink water. And they are suffering from malnutrition and dehydration. And because they have to go in the cover of darkness, so they don't eat or they don't simply take water. So they are suffering from dehydration. It is a very strange thing, the flying toilets. Flying toilets is a facetious name for a plastic bag that is used as simple collection device for human excreta when there are there's a lack of a proper toilet. According to UNDP report launched on November 9, 2006, 2 in 3 people are using flying toilets as primary mode of excreta disposal. And it is a very huge number. The next thing is inadequate sanitation during monthly periods and poor hygiene habits. Like we do not have good habits and no awareness to use of toilets and hand washing facilities. And the most alarming thing, 800,000 children die before the age of 5 just because of dehydration and diarrhea. This is a very alarming rate, 800,000. Lack of sanitation facilities in school. Children are at disadvantage in schools due to poor health, which directly reduces cognitive potential and indirect undermines schooling through absentees, attention deficits, and early dropouts. According to UNICEF study 2012, 55% of schools have inadequate sanitation facilities, and there is a very high percentage of absentees from school in girls during puberty because of lack of toilets or separate toilets. Lack of hand washing facilities is also leading to this, and the most learning is effective when they are not able to go to toilet or they have illnesses. These are the main challenges which we are facing in the developing countries just due to improper sanitation facilities. I will invite Adam, who will continue from here. Thank you.
Thank you, Melissa and Humaira. I will continue by the economic impact of the lack of sanitation facilities, whether in the market, whether in the house, or at the schools. So you can see it's clear that actually there is loss of $35 billion by not achieving the Millennium Development Goal of the sanitation. Why? Because of the sanitation illness related to low-income people and the treatment that was used for this. And this is actually caused also, it's not just for the illness, we are also talking about the household income, where you see the slide that women are not actually spending their time at house, they are spending their time to look for something to feed their families back home, to send the kid to schools. So also the illness will affect the household income. It will affect also the tourism, where we are talking about open defecation. There will be cholera outbreak in most cases, so there is no tourism. It will also impact. And also we have agriculture. We are talking about those women who are also doing agriculture on a daily basis, and also they cannot release themselves. And agriculture actually, the field that constructed, they don't have sanitation facilities in most of the developing countries we're talking about. So then this is also one of the main issues that it affects, the cost regarding the sanitation. Also, when we talk about fisheries, when we talk about water supply, so all of this together, within the Millennium Development Goals, till 2000 and up to 2015, 35 billion was lost. So let's think about sanitation from the way of just the economic impact. So you can see it's very clear that there's a lot of money was used But it's also, again, this is what we actually lost in terms of providing the clear sanitation. So let's go to Sustainable Development Goal. People agree that in UN to move from Millennium Development Goal to Sustainable Development Goal. But actually, before even we move from Millennium Development Goal to Sustainable Development Goal, we are quite sure that even the Millennium Development Goal within the countries we are talking about, developing countries in Africa and South Asia specifically, they never meet even Millennium Development Goals. Meaning because the amount of money that missed there, $35 billion US, but still people are still talking about Sustainable Development Goal. Then also the same thing, Sustainable Development Goal talk about ensure availability and sustainable management of water and sanitation for all. If we are really talking about water and sanitation for all, from the economic perspective, even from the human rights perspective, you need to look about these children who are saying we need a clean toilet. So we also know that good sanitation is necessary not just at homes, which is the most cases in the developing countries, but also it's good at schools and at workplace. When we talk about at the schools, it has to be the facility that it can address the privacy of the girls and then the boys and then the teachers at the same time. And also we are talking about the workplace. Workplace means that the factories, the agriculture fields, and the market, whatever people are working, it has to be there is proper, and we are talking about clean and safe toilets so that people can access. And also this will lead to equal participation in education and work, which will impact to the ultimate economy that we are talking about. So actually providing the clear sanitation facilities within the workplace and within the marketplace and within the schools, this will provide also economic impact. We also thought about the way forward, what needs to be done, and this is actually basically coming from the perspective of our own countries, which we experience and we live on a daily basis. One of them is consideration of cultural norms and values in designing the wash facilities. There is a lot of work was done within these countries as well, either from the UN agencies, INGOs, private sectors, government peoples, but still there is lack of understanding the behavior and then the needs and then the norms of the targeted people. If you come with your money as a donor and you have the ideas, you need to have a kind of dialogue with the beneficiaries to understand that is it possible for the latrine to be constructed in one place, as you see in the first slide. This is for men, this is for women, but it's not clear and it's not easy for some women to access the latrines where also the boys in the school or the men also accessing why it's still in the market. So actually to understand this, we need to have a dialogue, we need to talk to the people, we need to understand, because also when you construct the facility, when you leave behind, we need to make sure that somebody is taking care about this latrine and it's actually being used for the sake of the construction. And also this need to be from the first point, because in most cases, people, they go there, they see the situation, there's open defecation, you start constructing the latrines, you leave, you go back after 3-6 months, nobody's accessing the latrine, especially the females. Because you are talking about places where there is no electricity, meaning there is dark at night. So you need to consider all these things before you construct the latrines so that you make sure it will be accessible. The second thing also, we think that when we talk about the Millennium Development Goal, even the Sustainable Development Goal right now, it has something to do with the government. Because if the government should not strengthen the sanitation sector and make it one of the key priorities within the government agenda, it doesn't work for what we are thinking for. So basically that for everybody who's involved, even with the government or international INGOs, we need to make sure that this has to do something with the government first, because government is there to deliver this kind of activities. So then we are saying we need to make sure that this has something to do with the political priority in terms of the governments. I have been talking with one of the governors. We are celebrating World Water Day in 2015 in northern Iraq, where I used to work with Safe Children. When we said there is World Water Day, the governor said that he don't know that there is something called World Water Day. And then when we reached November, we are talking about Toilet Day, he completely ignores the idea. But when we talk about Sustainable Development Goal, he said, yeah, I hear that one. It was signed by UN. So that's why we are trying to make sure that government understand this is as a priority. And for us to make government to understand this as a priority, it has nothing to do with the resources. It's kind of thinking and mindset. All the governments must have sanitation integrated into education. What does that mean? Also, there is aspect of education for these communities to understand that if there is no proper use of toilet or the access to latrines, it can also impact on the health, because we are talking about 800,000 children lost their lives before they reach, the year of 5. What does that mean? It's not just a number of people who die. These are the young generations. They can be who are innovative, who can make the world a better place for all of us. So if we think from that point of view, we need to integrate with education. We need to give also hygiene awareness and educations, and kind of what we are doing right now. People need to celebrate that there is something called toilet day, something called water day, so that people understand this is very important at the school level, so that it can also contribute to raise the awareness within the people. Also support it with sufficient resources and concrete plans. It has something also to do with the resources. But the resources we're talking about, actually, the government, if it is not within the priority of the government, it also ends up that it cannot be implemented. So we're also trying to say that it has to be resource allocated for the sanitation, and also concrete plans to ensure that adequate facilities need to be constructed, whether at the market, at home, or at schools. And if you look at this picture of this small girl, we are not sure that whether if she needs a laptop, for example, one day in her life. We don't know if she needs to run for a public office, but we are quite sure that she needs a clean and safe toilet in every day of her life. So that's why, because of the importance of this, in 2013, United Nations came up with an idea of celebrating the Toilet Day in November 19th. Just to give you an idea, we give the same presentation actually at the Global Leadership Forum in DC, where we come up with all our other colleagues. And we thought that also it's good to bring this idea to share with you guys, and you guys also share it with others who are outside there, either family members or students with you in the same class or whoever relative, so that we can make an action, because we are actually trying to make an action and to make it possible for those who are lacking access and less lucky with more of us. So this is the end of our presentation. We are going to have a panel discussion, but before that, we have a specific case studies from 5 countries. So they will give their specific case studies. Then it will follow by discussion, questions, thoughts, incomes from you guys.